Hello, everybody, and welcome to Unfiltered Vet Discussion. We are so glad that you are joining us today with the Royal Wave. So, first, the housekeeping stuff. You hear me say it all the time, but please like, share, follow, comment on all the major social media platforms and all the major podcast platforms because we're there and we love to hear from you. And then you don't miss an episode when it comes out every week. So, please come follow us. We're here. So today's topic is addiction. Um, this kind of like how it's impacted us all, as well as how can we help and not cancel. And where this came out of was a personal story that I'm currently living and made me think about it is my daughter was dating a young man and it didn't work out because turns out he's an alcoholic and he didn't even understand about alcoholism. He didn't even understand his family had alcoholism. And he really, really, really reached out in a cry of help and said, Kelly, I need help. And you're always a straight shooter. Tell me what's going on. And he said, I changed his life that day when I met him in a neutral place to talk about why he's going through all this emotional pain. And the interesting thing was, I had a lot of backlash of people saying around me, well, why are you meeting with him? Why aren't you canceling him? Why, he has this behavior. And I'm like, he's a hurting human being. Why don't you hold out a hand to a hurting human being? It doesn't mean I have to walk his walk or his path. I can certainly direct him in the place and resources to get help. But I think we're kind of losing that sense of how do we help one another. It took an hour of my time to actually care, right? And why are we losing that? And how can each one of us step up to the plate when we see somebody suffering and go, how can I help? So I'm going to throw that out to the room. And I mean, addiction is everywhere. There's lots of different addictions, and we'll probably get into some of those today. And if you're one of the people, well, if you're two persons actually, if you're a person suffering from addictions or emotional turmoil inside, there are places to get help, and you should reach out and get them. And the second thing is if you're a person witnessing somebody emotionally struggle, instead of stopping and canceling them, start thinking, well, is there a way I can help? Not getting yourself tangled up in it, being in a healthy way, but think about your own behavior. So I'm going to toss it out to the group.
Yeah, and everybody, if I can, I'll open us up. In transparency for our listeners. So I'm in long-term recovery. So I got sober August 11th of 2008. I was a year and a half out of school. So I was a veterinarian while I was going through this. What I would say is that the behavior of someone with we'll say an alcohol and substance use disorder, the behavior is the thing that can be almost to the point of abhorrent, to us. Is like, how could you make that decision? Or why don't you, and we hear this in all of our literature, and we go is like, why don't you just stop? Why don't you just have one? Why don't, what you have this beautiful wife, husband, kids. You would think that you would not do that because of them. And it's just not when we get to that point, that the rational thinking part of our brain is not able to be accessed. It's literally we can't get there. And what I would also say, and one of the things you said, Kelly, that really struck is like your friend saying, well, why would you reach out to this person? Why wouldn't you cancel them? And one thing that we know about alcohol and substance use disorder is that trauma is the gateway drug. Is that we people with alcohol and substance use disorders almost all have four or more adverse childhood experiences that happened to them. So, they were physically abused as a child, sexually abused as a child, verbally abused as a child, had a parent or caregiver that had a use disorder or severe mental illness, saw violence in the home. Like there are these tests. And if you have four or more of those things, you're 7 to 10 times more likely to have an alcohol or substance use disorder than someone with none. very easy if I have none and I had a great childhood for me to look upon someone and just go, how could you do that? Where those changes in the brain happen when that person was 5, when they were 7, when they were 13, before they had a chance to do that. That framework was set. So I think that one thing of, instead of asking, and I really like how this gets phrased, is instead of asking what's wrong with you, saying, my gosh, what happened to you? Like, when you
Mm-hmm.
were a child that allowed this to happen. Because again, no once we get into recovery and we were able to use that thinking part of our brain again, we don't want to act like that. It's a way to address, the things that are going on. So just saying that, I think that's important, as far as, because the behavior of someone with an alcohol or substance use disorder can be one of the things that's really challenging. The lying, and I have a quote too from um, medical professionals in recovery, and they talk about physicians. And so it says, the intellect that physicians, or veterinarians will say in this case, veterinary professionals, rely on to learn their craft allows them to develop exceptional rationalization, denial, and resistance techniques. Thus, recognition of their disease is difficult. And so there's so much that's wrapped up, not,
Yeah.
since this is we're in a veterinary show, like talking about that as well. But um just as a person in recovery, like that judgment and shame is, and feeling that from other people is one of the other things that keeps us going out. And not blaming the world for for what's going on with me, but just, I don't have other ways to deal with shame and guilt. I don't have healthy ways of dealing with that because of the things that happened, when I was growing up. And that's the tool that's in the toolbox. So I think I'll say that to start, and then open it up to everybody else.
I'm speechless because I don't have similar challenges, but not to say that I don't have my own issues.
Yeah.
Um, I probably work harder than I should or need to. David too, yeah.
Guilty as charged.
But like alcohol, maybe like substances, I get a certain amount of um, invigoration from the outcome of work. The getting up on stage and speaking as an introvert fills my cup with extroversion that helps balance some of the introversion, which I guess makes me an ambivert rather than a pervert, um, although that probably fits as well. So I think we all have addictions,
Mm-hmm.
and it's really our ability to handle them or have resources to help us through them and not get caught on that huge Egyptian river denial that we actually have problems.
Mm-hmm.
So I will admit to things like imposter syndrome and overworking and probably even being a little bit of a hoarder of knowledge and information because I can't get enough of it. But I try to balance it out, and I think that's part of it. And I would challenge in all the hospitals and veterinarians with whom I have spoken at different times, we all have an addiction of some sort. David?
Oh yeah, and I know the workaholism very much as an ism, and I interviewed with Dave Nichol on his podcast and kind of admitted that, and my wife listened to it and was a little rightfully upset because, and my father, I learned it from him, um, and this is when I knew, and I'm a work in progress in this area, but at work, I have control. I have people that thank me and mean it and they want to spend time with me and I'm helpful, I get those intangible rewards. At home, it's chaos. I don't have control. I'm the low person on the totem pole. And I mentioned, and this is what I had shared with Dave, and but at the same time, I love what I do, so it's rewarding, but I recognize in myself, I also avoid the home to be over here. And that's where and I think some of that addiction comes into play because we use it to avoid something else
Mhm.
sometimes in that capacity. And when I recognize that, then okay, then yes, doesn't have to be that way.
Mhm.
It's easier said than done, of course.
But it's hard. That introspection is hard, right? Because like I talked to like this young man and things, I said, you got to bring your inner world to your outer world. And anytime you're hiding something, you got to look at why, even if it's just to yourself. And also own your emotions and talk to your emotions. And in my family, alcoholism runs rampant everywhere. And my daughters, it runs on both sides of her family. And I'm constantly having conversations with her. Your emotions are your way to health. So if you hide something, it's not good. But if you can talk about things, even if it's hard, that will help keep your ship going forward, right? Because boy, we still think hiding stuff is easier, but living with the outcome is harder than talking about it, right? And also with the whole cancel culture, like you said, Phil, it's easy to say, gosh, I'm better than you, or I have judgment over you, with not really asking why. Like you made a restatement or a rephrase of a statement, and my dyslexia didn't catch all the words, but it was very profound to say, hey, why don't I ask a question why a person's doing something versus making a judgment upon what I'm seeing happening, right? And I think we're so quick to judge because personally, then I see people feel better about themselves. Why do we do that?
Yeah, and what I would say, especially when we're talking about powerful process addictions, like sex, love, shopping, those types of things, and then obviously, alcohol and substances that really impact what's called dopamine saliency, in the brain, and that's what really throws off, that reward system gets thrown off, which gives us, what's the definition, the hallmark definition of addiction is compulsive behavior in the face of increasing consequences with a lack of ability to recognize the impact that it's having, and also a lack of ability to stop. So what I would say, and I'm so I don't want to minimize what Peter and David were saying about work, but if your significant other came up to you and said, we're getting a divorce, like you're working too much, like I'm out, and or the kids say something, and then in the face of that, I still go,
You don't change.
still doing that, I still don't change, and nor do I, and then and I'm rationalizing, the thing, and again, that drive or craving can be, it can be a positive thing, but then obviously also it can be a challenging thing. And I mean, that was for me when I had that, because I'm like, I'm a veterinarian, I've done these things in my life.
Yeah.
I'm like, I can't, like, I can't stop. And that's frightening, and I would have those, light bulb realizations. And I remember my mother saying to me, I don't understand this. She's like, you're smart. Like, why would you still drink? Like, why would you do that? And I really didn't have, I remember I was 32 and I didn't have a good answer for her. Like, I was like, yeah, I mean, you're right. Like, I really don't know why I'm still, in the face of all these things and the consequences that could happen, why I'm still doing that. And that's the tough part, is that, in the beginning, and again, well, I mean, I guess with process addiction too, but in the beginning, alcohol does something. Like, it fixes something. Like that screw that was in my chest that, tightened up, and I didn't feel like I belonged. I mean, I had my first time I got drunk was when I was 15. And I was like, man, that's it. Like, I can function in the world now, like, with this. Like, this is great. And it did, if I had, the first time I took a drink, I mean, I was 15, but like, if I got a DUI and I got fired and I got, all these things happened to me that first time, I might not have, you know, continued with it. But that's the thing, is the progression of consequences. And I remember when I was in, I was in for treatment, and I went to the psychologist, like, for my evaluation. He said, "Have you ever had any negative consequences from your drinking?" And I was like, "No." And he's like, "Have you ever had any run-ins with the law or been in fights?" I was like, "Yeah." And he's like, "Have you ever lost a job or been late to work because of drinking?" I was like, "Yeah." And it was just, and those are the, that's the thing that I couldn't wrap my head around, is knowing that. And he asked me if I had had any serious consequences, and I said no. And I genuinely thought I didn't. And that's the challenge, that we have to be able to have that. You hear that about that moment of clarity, with people with use disorders. And I thank God, I was in a place where people recognized what was going on with me. I was ready to hear the message, and frankly, I had the support of, my wife at the time,
Right.
well, my fiance at the time, and my family. Um, and it meant a lot. And I was also ready to do the work. So I don't know. It's hard. The hardest thing is seeing somebody that needs something and not being able, feeling powerless to change that course of events. And I'll say, as somebody, having been in recovery a long time and seeing that, is knowing that I myself don't have the power to get a single human being sober or drunk, or have them go out. Like, it's not my behaviors aren't going to, impact that. But I can be there, like you were, Kelly, and that may be the, they might not, may not change around, but I may get a call. I mean, this 2 weeks ago, I just got a call from a veterinary professional, and they, that I had talked to months ago, and they told me they're on the path, and they were like, "I just need you to know that talk you had with me, helped, help me move forward, and, we're grateful." And I just wanted to be there in that moment for that person. So, we don't know the impact that we're going to have, but it's also, it's just so hard seeing somebody go down that road.
Yeah,
Um,
it
you-
is. And that lack of control,
yeah,
lack of ability to influence it. I grew up with that.
yeah,
The alcoholism runs in our family,
Mhm.
and just with my mom, not being able, it was a nighttime thing.
yeah,
Uh, so impacting her, and certainly indirectly the family, but seeing that go through that, and then my brother as well, and
yeah,
they're both sober, but it that path is not easy, and
yeah,
trying to support somebody and not enable.
right,
Uh,
yeah. I think
It's
that's it. And I don't want to take over too, but that it makes me think of, like, when you have someone who comes in under the, we'll say at the clinic, someone comes in under the influence. That is, to get, for a human being to get to that point, that they come into their place of business under the influence, like, that person is struggling. But what happens is that it becomes, and we have ways to protect the practice, get that person off the floor, but also not necessarily make it a legal issue and more of a mental health issue. And that's one thing that I hope we're able to do over the next, decade. Is that, seeing when someone's like that, is that they're hurting. And again, that's one thing, like, that may not be the thing that changes them, but at least, we we do at practice, we try to have a 1 second chance, thing, because we can't necessarily keep doing that. But like if someone wants, we know enough about it, and that's also supported by the Workplace Suicide Prevention and Postvention Committee, that put out a paper as, second chance type things. And, as long as there's nothing else going on and there wasn't anything
Right.
nefarious that happened, it gives us an opportunity to try to offer that person help before we, part ways with them, from an employment standpoint.
I would also like to
say
point
that.
out from my own personal experience of lived experience, rear view mirror 2020 type of thing, right? So, the father of my daughter, and I say that because we had many different types of names on our relationship, so it's just easier to say father of our daughter, trying to explain the whole thing, had major depression. But looking backwards, I think he was addicted to Xanax.
Yeah.
And yeah, and as soon as the doctors took him off of Xanax, he slid hard.
Oh yeah.
He
Yep.
slid really hard. I mean, the depression was already way off the rails, and he wouldn't admit he was depressed and blamed everything else because he wanted the Xanax, right? Like he wanted that drug. And then when in reality, if I could turn back time and do everything different with him, because he did commit suicide almost 5 years ago, is I would have said, keep him on Xanax, get him stable, send him to Hazelton. Like,
Yeah.
like he needs to be in on a set program behind locked doors to deal, but nobody saw that Xanax was the real problem, including myself, because we were all focused on the mental health issue, right? So these addictions can be layered under another thing, right? And the addiction was adding fuel to the depression, because he was so addicted to Xanax and he was looking for it everywhere.
Oh, yeah. Yeah.
Right?
Yeah, it's a hard one to come off of. Yeah.
Yeah. And then of course the hospitals stopped giving it. The doctors started prescribing something else, but this something else didn't hit the dopamine spot in the same way. So then the spiral, so I got a moment to sit and think about it. So I'm telling everybody else, in case somebody's hearing this and you're with somebody who's majorly depressed using Xanax, take a hard look at that. Live from my moment, that looking backwards, like that is a thing.
Yeah.
Hmm.
So I don't have personal stories,
Hmm.
fortunately, I guess, except for my dad was a workaholic. My mom was a workaholic. And, my dad and I both are running from emotions. We use work to avoid dealing with the emotional side of things.
Yeah.
My therapist has been working on that for a long time. It's not getting any closer. I cry at movies, but not at home. Anyhow, but what I really want to point out is what Kelly did takes huge gumption to actually try to help others. And we're the veterinarians and David as a veterinarian by blood, we naturally look to help others. And in many ways, what David does helps others as well, whether it's buying a hospital or selling a hospital. But to take on an individual and have the hard conversation, the courageous conversation, that's hard. I mean, that is putting yourself out there, and you may end up really making a difference as Kelly did. But you never know. And so I think part of what we have to be cognizant about is we want to help, but what are the lane lines that we stay in so that we don't hurt at the same time? Because what you did, Kelly, in a large portion is you took his emotions into you.
Sort of. Yeah. I just reframed them. But yeah, I mean, basically, I gave him education. Like, This is what this is. Do you know that? This is how life works. Did anybody tell you that? And if you put this off, the 2x4 goes to a 4x8, and the universe is just going to whack the shit out of you even harder. So you think you're hurting now, you have no idea how much more you can hurt, right? Because, I've had those moments where the 2x4 comes by a 4x8 because I'm like, yeah, I'm just going to kick the can down the road and that will solve the problem, right? And I'm like, F no, that mother trucker hurts, right? And so, as somebody who's older, I can kind of go on my life experience, but I also set boundaries, Peter. I said, I don't want to hear from you if you're not doing your work. Don't waste my time.
Well, all the four of us are all PPS, professional problem solvers.
Mm-hmm.
Yeah.
And we do it for a living. And what Phil, when you walk into an exam room, you solve a problem. When somebody comes and talks to you, you solve a problem. David, you solve problems. Kelly, you solve
Yeah.
problems. And I respond to too many emails and LinkedIn reaches and texts because I'm a professional problem solver. And so we all have a little MacGyver in it, us. It's just I have to know where my lane lines are and
Yes.
when I need to send that person to David or to Kelly or to Phil because that's not my strength. And I think we get into trouble when we get out of our lane lines and try to solve problems that are not within our purview.
That's such a great point, Peter, and that it's also one of the things that when I hit, because I do the QPR instruction, on suicide prevention, and that is all of our biggest fears is like I don't know what to say. I don't know how to fix, is that, like you said, is like I want to go in, and if I don't know how to fix that problem, then I don't want to be, I'm scared that I'm not going to do the right thing. Where it's more like what Kelly did is just sharing space with another human being, which is in and of itself is difficult,
Yeah.
for a lot of us to do. But to just say, and yes, having a small toolbox and saying, if you're ready to take the next step, these are let me make this phone call, and you schedule an appointment with whoever, or I'll take you over now to this thing. But it's the not solving the problem in the moment. It's hearing that person, hearing their pain, and just saying, I want to help you. Are you open to getting some help? Almost no matter, I don't want to say no matter what it is, but it's just offering that thing. Like, I want you to get better. Would you be open to us finding help for you? And it's like, I don't have to fix the problem. And like Peter said, like, I do need to do a little bit of work so that I know where on the phone, the Rolodex showing my age, where in that, where in that am I going to find the resource that I can send this person to get them help. And there's so many great, and we'll put it in the show notes. But there's so many great organizations and, in veterinary medicine, that even if it's somebody that isn't in veterinary medicine, you can call one of these and they'll get you,
Mhm.
where you need to go. So,
And
yeah.
it does, because like with this young man, I just pulled out my phone and Alcoholics Anonymous. I mean, being raised
Yep.
in alcoholic families, that is definitely a word, right? That I know. And I said, hey, look, here's all the meetings.
Yeah.
And he's like, well, what do they cost? I'm like, they don't.
Yeah.
They're
Yeah.
free. And you need the cost is you walking through the door.
That's the hardest
Investing
part.
the time. Yeah.
Yeah. Yeah. And I said, they're even online these days, thanks to the COVID era, right? Like they've modernized. You
Yeah.
don't even have to leave your home, but I actually suggest you do go in person. It's a different experience, but at least start somewhere, right? But you're right. Those educational, there's resources, but I mean, Phil, you can speak to this probably more than anybody is, but that first step one's a doozy,
Oh
right?
yeah. I mean, I don't know. I genuinely don't know if I don't know that I would have been here if I wasn't a veterinarian. and where I'm going with that is that I, also too, like burnout was part, work, like I was working 70, almost 80 hours a week. Like I was working 7 days a week because I thought that's what I was supposed to do as a veterinarian. And I had so much self-worth wrapped up in it that when I went to get the help that I needed to get to in most states, you can go to an organization that's funded by the state boards, either medicine and nursing and all this, it's a private organization that will get you help and protect your license. But if you don't do those things, then I can't, I have to honor that, like I am not safe to practice, like I don't have I forget what it is, something around safety to practice. But that, because that was put to me, is that if I don't go to treatment, I can't be a veterinarian. That was one of the big drivers for me, and I would hear, I'd be in treatment and people would be like, oh, this is, I'm just never going to practice my profession again. I don't care. It's just, it's the whole burn it all down, over, I mean, not one small thing, but, and I'm like, I don't want to do that. Like, I love being a veterinarian. And, again, what I learned, also treatment works 100%. We hear so much about the down, or the ills of, substance use, disorder, but we don't hear as many stories of recovery.
Success.
And it's just, I have to say, like that, I mean, it changed who I was, like at my core. And it gave me tools to love veterinary medicine. Like I am a significantly better practitioner because of being in recovery, because it gives me tools of empathy. It gives me tools of gratitude. It allows me to throttle my stress response. Like I don't jump to conclusions as much as I used to, but none of those have anything to do with differential diagnoses for a vomiting cat. Like none of those are the things that I learned in school, or my ability to interpret, radiographs or, an ultrasound. But they affect my thinking, and how I interact with my clients and how I interact with my team. But I just have to say, like, really, like, I mean, veterinary professionals helped save my life because they were brave enough to get me the help that I needed. The tools, the treatment that I went to saved my life. And then that allowed me to have a beautiful career. Like I can be this far out, just like Peter. And that's why, I know both of us are so passionate about the profession. Is I love this profession. I know Peter does too. And I want veterinarians and veterinary professionals that are starting now to be able to have not the whole experience I had, but using some of those tools though, to be able to enjoy this profession. And that's the beautiful thing about recovery, is that we go through almost what's called post-traumatic growth, which is on the other end of the spectrum of post-traumatic stress disorder, where we have a new hope and a new view on life. We have a reason to be, we have a significant level of gratitude, that we didn't have. And it just changes your view on the world. And it's really amazing when I look at recovery and I look at the elements of post-traumatic growth. That was really what the end result was. And so that's, because it's a traumatic event. I mean, being in addiction for 20 something years, there's a lot of trauma there. So
it'd be nice if there were more success stories, I think, to encourage folks.
So
that it doesn't have to be where it is.
What's interesting is that two things. One is that there's so much stigma around alcohol and substance use disorder that oftentimes professionals don't. I'll tell you, there's tons of veterinary professionals in recovery, like I know, but that one thing, the stigma, and then two is that in 12-step recovery, there is this principle of anonymity, is that you don't go around waving a flag, saying,
Right.
That you're sober. And I would say that's one thing that's kind of being challenged, that maybe we do that too much, because to your point, David, is that we don't hear those stories, of recovery. And it's an ego and humility thing, why we're not supposed to do that. And I get that aspect, but it's also, if we're able to do it in a way that's tempered, and being able to share that there is success, then how else would we know, that there's light on the other side.
You know, if you think about it, just turn on the TV and look for celebrating success versus celebrating negativity.
Oh yeah.
You know,
Mhm.
we don't take the time. Hallmark Network doesn't get nearly the airtime that CNN, MSNBC, and Fox get.
Well played, sir.
Yeah.
So the veterinary field doesn't have a group that focuses on happy veterinarians and the joyful vet. But we need that. We don't celebrate the success stories sufficiently. You know, I know Fetch DVM 360 has veterinary heroes. Where are the heroes? Why aren't we talking about the heroes?
Yeah.
We focus on the negative so much. And we have, one of the words that needs to come out of this conversation today is awareness.
Yeah.
And we have so many intrinsic issues within our businesses and extrinsic variables right now that come through our digital devices that are impacting how we think, how we act, and how we deal with things. It is important for all of us to be aware of ourselves and the people around us and be even more vigilant than we have ever been, because the number of variables that are touching us every day is magnified much more than it was before we had digital devices, before we had people saying bad things about us on Yelp and other resources. And so I think the most important thing we need to do is be self-aware, but then aware of the people that we have in our family of stakeholders, whomever they may be.
Yeah.
Mhm. Mhm. I agree. And I also think you have the topic of your next book, Peter.
Awareness.
Nope, Joyful Vet.
Trust me, I'm working on that one actually. That's actually in the process.
Because just like, James Harriet has, you just bond with those stories and those lives, just having the joyful veterinarian stories, Phil throw in a few chapters of the success stories of veterinarians going through addiction. I mean, that's pretty powerful right there.
Phil's on my list. My shit list. I mean my short list.
This guy.
Very good.
Yeah. So I think what you said, Peter, was wrapping it up and also just boils down to kind of what we're talking about. Be aware of yourself. And if you think you have an addiction problem, like Phil said, there's lots of places, and we'll put some of them in the comments. Go get checked out. Like Phil, you walked in and got an assessment, right? When the guy was asking you
I
things.
did. I mean, yes, not of my own volition, but yes, I
Right.
did go in.
But there was a
Yes, I did.
checklist.
Yeah. But what I'll say too is here, one of the things that I heard in, because I've been in 12-step recovery, my whole time that I've been sober. And in meetings, I remember, basically people that don't have a issue drinking don't think about, do they have an issue drinking?
Hmm.
Like you just, and I was like, and it just hit me because I was like, yeah, because they're, I'd go out to dinner with people and, they'd have a beer, they'd have maybe one cocktail or a glass of wine. And then the waitress would come back, or the server would come back and say, would you like another? And they go, no, I'll have a glass of water. And I remember I was like, why in the hell did you order the first one? Like, why even, why have one? And because I was, not pairing it, but it was like, hey, double tall Stolian Red Bull, and then go ahead and put another one in because I'm going to be done with this one by the time you put it on the table. And so I'd be 4 drinks deep, like at dinner. And that was just that was, anybody that went out with me knew that was how I drank. And being genuinely, aware is like, man, I remember, that glass hit and I felt better just seeing the glass hit the table. And quote unquote normal drinkers don't have that response. Like that's not the thing. And the other thing is that, I had some other things that got me into treatment, but they said to me, they were like, oh yeah, you can't drink either. And the fear that came over me when they told me that, because I was like, well, clearly I'll still be able to drink.
Right.
And the fear that came over me that I wasn't going to be able, and I'm grateful I was in treatment, because I was aware of how powerful that feeling was. I was like, wow, maybe I am an alcoholic, even though I was, the amounts, I mean, not that it matters, but the amounts I was drinking, it's clear that I was, had an alcohol use disorder as well. But yeah, like just that, if you're thinking about it, and then also you're not alone. Again, there's 12 to 15% of medical professionals at some point in their career will meet criteria for an alcohol use disorder. In 2017, I think it was, there was a survey that was done. 12.9% of male physicians and 21.4% of female physicians met criteria for alcohol use disorder. So, and one in six physicians in a study that was done 2 years ago admit to either using medications or drinking while on the job. Yeah, post 1 in 7.
I can give you the drug details, but I don't want to make it any more depressing with respect to opioids from that standpoint.
Yep.
Yeah.
So,
and I think too, that's one of those things from awareness, is that the conversations that we have around opioids, the stigma, the shame, the legal, the judgment is, and I'm not suggesting that we don't monitor those things, but it keeps someone that does have a potential issue or something like that, the language that we use is not supportive of someone who has an issue of coming forward and saying, I need help. Like, it just isn't. So we're working on some of those things as well. And it's fascinating what they did in human medicine, which actually I'm going to be on a task force for AVSB. Dr. Beth Bennett asked me to be on a task force to help with some of that language. So
Right.
super excited.
I want to throw, as we wrap up,
Yeah.
I want to throw a topic out for future thought, which is you went through the pipeline of undergrad, vet school, coming out of vet school problems.
Yeah.
How much can we start, or how much should we hold the veterinary schools and AAVSB, et cetera, responsible for identifying high-risk candidates during the application process going forward?
So I think, yes, I agreed that would be a great, next episode. Remember what we said in the beginning about four or more ACEs. You're 7 to 10 times more likely to have an alcohol or substance use disorder, 6 times more likely to have ADHD, 7 times more likely to have depression, 32 times more likely to have a suicide attempt. So what I would say and remember, vet school didn't make me drink the way that I did. I was drinking alcoholically from the time I was 15. It was my solution, if you will, to everything else. My personal belief is I think it's reasonable, not necessarily not quote unquote weeding out, but when freshmen come in, is assessing them for ACEs, and just if they come up for 3 or 4 more, is just we get everybody together, have veterinarians who have that and have been through it. Hey, just like in our patients, like if we had something that caused this number of risk factors, or this increase this risk, is just do potentially more counseling and have peer support
preventive
groups. And and I think, because again, like I just don't know, like I feel like that probably would have helped me, if I just knew that I wasn't alone, and then I wasn't,
were you not in a place to be ready to hear it?
Well, that idea. So I mean, that goes in with stigma and like the go mentality and stuff. But I think hearing from professors, hearing from people that successful, in the profession that went through those things, I think was one of the most powerful things. I mean, I do remember that. Sorry, Peter, I didn't. I'm passionate about it because I think that potentially might be a way. I don't know if I would imagine that we could save lives and keep people in the profession if we did that early. I just wouldn't. What I wouldn't ask is that people with those ACEs aren't allowed to come to vet school. Like, because
I'm not
because I think I'm
suggesting
a
any of
great,
that.
and I don't think that's what you were insinuating, but it's just that has been said by some old administrators that I talked to, but I do think that's something for us to look into. And we have such a capacity now for mental health in the profession that maybe it's time, for us to, try to protect
Well,
our new students.
again, as we try to wrap up, it goes to awareness, because if you think about it, making the faculty aware of the students' mental health issues might change some of the pressures that are put on students during that extremely intense 4-year
Yeah.
academic position, because many faculty are not as aware
Yeah.
from that standpoint. So I think we got a whole nother podcast that we can go through
Yeah. Yep.
about this. And I am never playing poker with Phil Richmond, because he just keeps talking about 4 aces, and I'm lucky if I have deuces wild.
But too, it's aces are it's I think 12.5% of the US population has 4 or more. So it's not, it's a conversation. I think everybody, it's not just the profession, but it's just fascinating the impact that that it has as a as an increased risk factor for correlation of mental health and other disease and cardiovascular disease too. I think it's 2 to 3 times more likely to have arteriosclerosis, and just from stress and that kind of thing. But yeah.
Well,
interesting.
To be continued. I don't even think we can wrap up. I think we just need to hit the
just shut it down.
dot on it.
Yeah.
Well, that means
if
I'm
you're
getting
listening, resources, I do want to say as resources. So Veterinary Hope Foundation, Florida Veterinary Medical Association, the Inspire program, fema.org/inspire. NAMV, Not One More Vet. The group that has made the biggest impact for me is the VIN Foundation Vets in Recovery Group. So there's about 30 of us that meet regularly on Sundays virtually, and it's fantastic, and you really, it's just great. So if you have something, we'll put that in the show notes, but I just wanted to verbally say that if you're listening and driving.
Good stuff.
We'll have some resources for you.
Perfect. Wonderful. Well, thank you for everybody who joined us today. We'd love to hear from you. And see you next time. We'll wish you adieu.